Topic for INSET and NEET PG, which is frequently asked, that is Mallory's tear and Boerhaave perforation. Okay, Mallory's is basically a mucosal tear, whereas Boerhaave perforation is a perforation at the lower third of esophagus. So that major difference is it's a mucosal tear, which is at the G junction, esophagogastric junction. Boerhaave perforation is at the lower third of esophagus. The clinical profile of Mallory's in the question will be mainly hematemesis. Okay, patient will be mostly stable, and in management, first line is resuscitation. In any kind of upper GI bleed, we do resuscitation. Whether it's a Mallory's or Boerhaave, we have to do resuscitation. But the thing is, in Mallory's, most of the cases are managed with resuscitation only. With IV fluids, we have to do cross-matching, blood arrange, we have to transfuse if needed. Okay, only if patient is not managed with resuscitation alone, then we go for endoscopic procedures, which is endoscopic coagulation of the tear. We can do it twice before going for surgery. Rarely surgery is needed. Okay, mostly they are managed with resuscitation. So we have to go in the option with resuscitation followed by endoscopic coagulation. But in Boerhaave, whose clinical profile majorly includes Macular striate, have been asked number of times and will be asked. It includes retrosternal pain, vomiting, and emphysema, that is subcutaneous air. And in this, management is purely surgical. If the patient comes within 24 hours, we will go for primary repair. And if he comes after 24 hours, we will do an esophageal exclusion with an FJ for his nutrition. Okay, so the clinical profile majorly will be a patient coming after severe bouts of vomiting with hematemesis, clinically stable. It's a Mallory's tear. If they ask in the management what you will do, resuscitation. At the most, endoscopic procedure will be needed. If they ask in the clinical profile a patient after severe bouts of vomiting experiencing retrosternal pain, vomiting, then it's a perforation. They will not ask you whether it is Mallory's tear or perforation. They will ask the management. Then you have to go for resuscitation followed by surgical management. Surgical management, mostly they will give you the timeline. You have to, if he is coming after 24 hours, it is esophageal exclusion with FJ. Few MCQs regarding esophageal perforation. The most common cause is iatrogenic, and the most common spontaneous cause is Boerhaave, which we studied now. And investigation of choice is CT scan with oral contrast. So this is in short regarding Mallory's and Boerhaave. Keep revising. All the best.